Hi, everybody. I am Michelle Lewis with Siouxland District Health Department, and I am going to be providing just kind of an update on our Community Health Needs Assessment Health Improvement Plan, otherwise known as our CHA-CHIP, for the year. As you can see on the screen, what our priorities were for 2022 to 2024. They were mental health, preventative health, substance misuse, and physical health. So those are very broad topics that we've been working on for the last 2 years and have one more year to go. Underneath those are kind of some more bulleted points as specific things that we've been working on in each of those areas. As you know, during the GCC meeting, we do provide a 5-minute health update. We are providing health updates on these initiatives through the CHA-CHIP priorities. So I do want to kind of now just show you the scorecard that kind of shows maybe the progress or the additional progress that we still need to make with those areas. So within the mental health, you can see that we track suicide deaths and then also kind of mental health distress days and whatnot. I'm not going to read through this whole chart. You can kind of look at it. But basically, it's the indicators from each of those 4 areas that we track to kind of measure progress. It is color coded, so the things in red indicate that we probably need some work to do. Those that are yellow, or like I said, it's just stable. We haven't made much change. And the green is positive changes that we've really improved those areas. So again, within the mental health area, unfortunately, we do see some red that our suicide death rates have increased since our baseline data, as well as our frequent mental health days. I should also point out that the data is not necessarily from the current year. So when we collected our baseline data in 2021, we collected the most current data that was available to us. And you'll see the date in parentheses of when that data, or the source of that data, the year of that data. And then as we progress through each year, you will be also able to see the year that the data is actually coming from. The preventative health, again, that was more looking at STI prevention and then just preventative screenings. Our gonorrhea rates have improved. Unfortunately, our syphilis rates have not. They've gone in the wrong direction along with our congenital syphilis. And then we don't really have much data on the colonoscopy, and then also those that have that still have a personal doctor. So no new data has been released since the baseline in 2018. Within our substance abuse area, those numbers have improved, which is good. You do see some green. I do know, unfortunately, with that first item there, the decreased number of drug-exposed infants born in local hospitals. As you can see, the 22 data is up there at 62. We did just complete and get final numbers for the 2023 data. And unfortunately, we did go in the wrong direction, and we've hit an all-time high for that. So that would be actually shown in next year's column. So again, things just kind of pivot, and they're good one year, not so good the next year. That final category there is the obesity and chronic disease. Again, unfortunately, there is a lot of red there, looking at obesity rates, food insecurity rates, and access to physical activity and activity levels. So the one thing that kind of has stayed steady is the food insecurity rate. So this is just the report card that we use. This is indicative of Woodbury County data. And so it just kind of monitors our progress. So we have one more year to continue to work on these initiatives and hopefully to get a little bit more green in that final column by next year. So there are committees working on this. So if you do have other ideas or a passion for any of those things and want to be involved, I encourage you to reach out to these individuals. So each of those priority areas that we've just kind of covered do have coalitions that meet on a regular basis. So there is the mental health roundtable, there's an STI coalition, there's a couple coalitions that focus on that substance misuse, and then again, a few coalitions towards the bottom that focus more on the physical activity and nutrition things. So you can reach out to those individuals on the screen, or you can always email me and I can let you know when their next meeting is. So the final thing I want to point out is that even though we are in the final year of the most current CHA-CHIP cycle, like I said, we just have that one more year to complete some of the action plans and to improve that data. We are simultaneously kicking off the next cycle. So you can see here that the next CHA-CHIP cycle will be kicked off on February 29th, actually is our kickoff date. We are going to be holding a meeting at Western Iowa Tech just to kind of reconvene everybody, to kind of kick it off, but then also to kind of discuss the vision. Where do we want to be in 2027? What is the health of the community going to look like? What are our goals for Siouxland to be looking like? So I really encourage you, if you are able to make it, to go ahead and scan that QR code. You can sign up there. But again, we do these needs assessments every 3 years because data is changing, health issues are changing, our environment's constantly changing, and what might have been looking great 3 years ago may not be looking so great today. And then we might need to focus in on those initiatives for the next 3 years. So it's just a continuous cycle of really addressing what are the current hot issues in our community. So if you would like to be a part of that kickoff meeting, please go ahead and, like I said, scan that QR code and join us. So that's all I have. Thanks.